Hello everybody, it's Mario Makayaon, and I put this APU simulation presentation together in the context of our efforts to somehow restructure skills and simulation. Wanted to give you guys a little history on our past simulation delivery. It first started with our one simulation per semester modality. In the ELM program, we started with 6 assigned simulation hours per semester, and in these 6 hours, simulation was delivered in one day, where student activity was comprised of 2 hours for actual hands-on simulation and 4 hours of case studies and skills lab activity. In the 2+2 and traditional undergrad programs, we started with 3 assigned simulation hours per semester. And like the ELM program, we used all 3 hours in one day. This modality changed when Badri from the BRN questioned our delivery of simulation and specified that skills and case studies were not hands-on simulation. So we eventually modified it, and this is how simulation is now in the APU Simulation Centers. In the ELM program, all cohorts get at least an average of 3 to 4 simulations per semester, with each simulation running about 2 hours. In each simulation session, every student is hands-on. In the 2+2, LVN to BSN, and traditional undergrad programs, all cohorts get at least an average of 2 simulations per semester, with each simulation running about 1.5 to 2 hours. Again, in each simulation session, every student is hands-on. Now, in this video, if you take a look, you notice that there are 5 students participating in this particular scenario. One student is in a jacket and is posing as the mother. In the far back, you have a student who is the RT, who is seated. You have a documentation person who's leaning against the window. You also have the primary nurse as well as the medications nurse who is looking at the primary as she's reading the orders. You notice again that there's not too much engagement in this particular scenario. This is a group of 4. I want you to pay attention to the student in the far left and notice how she just stands there during the entire time of this little clip. One student will start documenting, and 2 students are about to engage in assessment. A little bit further in the video, you notice that she's still there in the corner, and 3 are engaging in patient care. Moving on to a modality where we have 3 students, you notice in this particular video, all 3 students are engaged. One is auscultating the thoracic aspect, and you have another about ready to start with the blood pressure. The other student is documenting, but all 3 are engaged with the student, or rather with the patient. The next slide, we've identified in the past 7 years that a group of 2 to 3 students per session seems to work out best. 4 to 5 students usually have participants that aren't engaged in the simulation. However, we do acknowledge that there are a few simulations that would work with 4 to 5 participants, such as code blue scenarios, postpartum hemorrhage, and some other intense crisis scenarios. Thoughts on proposal 3. When I watched the video, I noticed that the students, it was suggested that students maintain a simulation activity portfolio under which skill checks and demonstrations were the responsibility of the designated skills and sim faculty. Does this mean that APU is suggesting to define skills activity as simulation? The proposal also suggests that students participate in virtual cases, which Linda referred to as videos, but not ATI videos. These videos had questions and tests which were rubric-based. Again, are we redefining simulation and equating it to this particular activity? It seems that we're being asked to consider these activities sufficient to be counted as simulation hours. Now, I thought it would be best to put out a definition of simulation, not based on what we've defined it to be, but more so the agencies out there. ANACSL is one, the International Nursing Association for Clinical Simulation and Learning. They define simulation as a planned simulation-based experience in which participants are engrossed in a situation or setting as they would be if they were in the real world. The goal is to evoke or replicate lifelike aspects in a fully interactive fashion. The NCSBN defines simulation. They actually adopted GABA's simulation definition, and they simply define it as a technique, not a technology, to replace or amplify real experiences with guided experiences that evoke or replicate substantial aspects of the real world in a fully interactive manner. Now, in 2015, the BRN conducted a simulation and nursing education survey. They took a sample of 1,500 new RNs who graduated from California nursing degree programs between 2012 and 2014. And what they identified from their responses were the following improvements for simulation. One was more experiences. Another was more use of the simulation laboratory per course, fewer students per mannequin, realistic experiences that include prioritizing tasks and managing multiple patients, offering open hours in the simulation lab for practice, emergency room and code blue training, greater use of live actors as standardized patients. These are my references. Wanted to put this out there to you guys just so that we could have a reference as to what guidelines that we've been abiding with for the past 7 years. Wanted to also let you guys know that the changes in simulation haven't been done based on a whim or the decision of a person. We do have the simulation committee that is guiding any changes in simulation. And in the past 7 years, the majority of why we've changed the face of simulation the way it is currently was based on student feedback, faculty feedback, as well as best practices. And so I wanted, again, to give us some type of reference as we pursue identifying a modality that would be cost effective, but at the same time, a quality product. And so thanks so much for listening, and hope to hear from you guys. If you want to contact me, please shoot me an email, or just talk to me if you see me. Anyway, God bless, and hope to see you guys. Thanks.